Empire Television, Kern County In Depth with 17's Jim Scott.
Welcome. Good to have you with us this weekend. Kern County's Board of Supervisors took stock of their options on Tuesday as they considered what they should do, if anything, to allow medicinal cannabis dispensaries in the unincorporated areas of Kern. But why, after banning all dispensaries in 2017, would supervisors want to open up this can of worms again? The short answer is a measure that has already qualified for the March primary election ballot that would regulate medicinal cannabis outlets and essentially take control away from the county. According to Planning Director Lorelei Oviatt, if passed, the measure proposed by David Abbasi and his Central Valley Cannabis Group would legalize the sale of medicinal cannabis and would allow shops that were open before January 1st of 2018 to reopen so long as they are located farther than 1,000 feet from a school. It would also allow agricultural cultivation of marijuana. It does not impose a tax, but says supervisors could do so at their discretion after the measure passes. Oviatt told supervisors if they are not content with this measure, they essentially have two options. First, they can enact their own ordinance without voter approval, but Oviatt said that could take 4 to 6 months, which would mean the ordinance would not be considered until perhaps after the primary election. That left supervisors with basically one other option: to put their own measure on the ballot.
Staff is proposing a framework today for that initiative. You are not adopting an initiative today. You are making a referral to County Council and staff to actually write the ordinance, prepare it as an initiative, and then it would have to come back to you for another hearing.
A number of medicinal cannabis supporters did not support the idea of the county putting its own initiative on the ballot, claiming that would split the vote between two measures that would legalize the sale of medicinal cannabis, possibly dooming both measures at the polls. Oviatt said the county-backed measure would differ substantially from the Central Valley cannabis measure. The county measure would only allow for the sale of medicinal cannabis. It would also include additional safety measures for setbacks or buffer zones, and dispensary owners would be required to obtain a conditional use permit from the county. At least that's the way it is framed at this time. All right, joining me in studio today, 1st District Supervisor Mick Gleason and local attorney Phil Ganong, who is counsel for the local cannabis advocacy group, Kern Citizens for Patient Rights. Gentlemen, welcome once again. Good to have you. Thanks for coming in. Well, Supervisor Gleason, as I recall, when you voted to ban the dispensaries and all retail sales back in 2017, you and Supervisor Maggard said at some point you want to come back and revisit the issue of medicinal cannabis, and here you are.
Right.
Now, Tuesday you said you're committed to making sure the board gets this right. What do you mean?
Well, I think I've learned a lot in the past 3 years and going through that whole experience, and I've been convinced that there is a bona fide real need for and real value for medicinal cannabis. I didn't believe that before. But after going through the process, I believe that's there. I believe that there are genuine patients who have genuine needs, and marijuana satisfies those needs. And so I'm looking at what's going on in the landscape now. I see an ordinance out there that's going to be on the, initiative that's going to be on the March ballot. I think it's poorly constructed. I don't think it's going to do what we need it to do. It's not focused on the patient. It's focused on business, and I don't like it. And so I think Kern County will not support that initiative, whether it's competed against or not. So I think it's time to put it to the test and find out if Kern County would support a ballot measure that would be focused on the patient, providing confidence, a trustworthy measure that, a process that we can have confidence.
Right. Well, that's probably music to the ears of the man sitting next to you, Phil Ganong, because you have witnessed the county's handling of the cannabis issue from the onset. So your thoughts, Mr. Ganong, on the Board of Supervisors' move Tuesday to draft their own ballot measure?
Well, yes, I've been doing this for almost a decade now, and it's good to see the tenor change. And I have to say, in watching the meeting and listening to Supervisor Gleason express his views, I took him genuinely at heart, and I would say that there's good reason that a lot of people in the medicinal cannabis industry don't trust the board or the county. And one of the things that really leaves them raw is that there were a few people that were out there trying to do it correctly, doing it right, doing what the county asked them to do, when the county asked them to do it, and they spent tens of thousands of dollars to do it, only to be, at the end, to be shut down.
Right.
I understand where the county wants to start perhaps with a clean slate, but there are a lot of actors out there that are good actors.
Yeah.
And they basically broke their hammer on an anvil of trying to convince the county that they were good actors, while the county allowed illegal operations to flourish and to drain money away from these legal operations.
Let me ask Supervisor Gleason about that then, because it sounds like you're going to wipe the slate clean. You're going to have every dispensary owner who wants to get back in this game, if your initiative goes on the ballot and passes, they will have to obtain conditional use permits and go through the process. So is there any accommodation for the people that Mr. Ganong referred to, the good actors, the ones that played by the rules and spent a lot of money?
Yeah, I agree with Phil, what he's saying about there being some good actors. I don't think I'd say there were many. It was a very immature industry and very raw, confrontational discussion at board meetings by people who were interested only, in my mind, of expanding the footprint of marijuana in the community. And none of the arguments I heard convinced me that there were many of them that were focused purely on a very select group of patients who had the bona fide need for that medicinal marijuana.
Okay.
And that's what I want to do.
Now, as I understand it, there would be no limits placed on the number of dispensaries in the framework of the ballot initiative.
Yeah, I don't know that. Don't know that yet. I think, in my mind, that's still to be debated. We're still working through that.
One idea is to let the marketplace dictate, right?
Yeah, I don't know if I'd go for that.
Now,
but
because look what happened in Rosemont. I mean, Zach Scribner, Supervisor Scribner, says he's for this, at least for this framework, and to explore this, because in Rosemont, a town of 18,000 people, there are 21 dispensaries.
Yeah, it's wild west.
Huh?
There's probably only 4 now that are operating.
There's a cluster of dispensaries in Oildale that don't quite reflect the population. So perhaps, I don't know, perhaps there's a good rationale for limiting the number, and I don't know how you get at that figure.
Well, I'm sorry.
No, go ahead.
Well, I was just going to say, look, I got a degree in international economics from UC Berkeley, and I was a little liberal, okay, but it was international. Come on. But the point is that when Lorelei said, we should allow the marketplace to determine the demand, what she's really saying is the marketplace isn't just driven by people who need medicinal cannabis and want to shop it. It's also going to be driven by the community concerns, and that's the beauty or the benefit of the CUP process.
That's what I was going. Yeah,
is that people can come in and say, no, we don't want it here, we want it over there. Plus, what you guys are proposing to go back to the industrial zones, although I have problems with it because of transportation issues. Well, look, we're talking about some people that can't drive. They're sick. They can't drive. How are they going to get there? I guess there's Lyft. But then we have people that are also on limited incomes. Laying that aside for a moment, allowing the community to speak, and allow both the patients and the people that have concerns about what it's going to do to the neighborhood through the CUP process, I think is a good way to do it.
I agree.
Because if you don't, then you wind up with a few organizations that are controlling price, they're controlling quality, and they're controlling service. And that's not a good American way to do business.
We'll see how this plays out.
I agree.
The staff should come by. The staff should come back in September with a rough draft.
Right.
I remember the conversation you and I had back in early 2017, and what you said yesterday struck me. You said you've become enlightened over this issue through the many conversations and the comments that have been to the board, have been given to the board. In 2017, maybe you were less so, huh?
Yeah, I was just overwhelmed by the negatives of what I was seeing, what I was listening to, and the name calling and the immaturity of the entire experience. But through it all, and I talked to several people that were involved, that there were a couple of people that I thought were genuine, they were real, they were good business people trying to do the right thing, and they had the same focus as I have, which is to satisfy that patient, not necessarily just expand the marijuana footprint. And they want to satisfy satisfy that patient. They want to deliver a quality product in a trustworthy manner, and they want to leave as little footprint as possible in delivering those capabilities.
All right, I'm out of time. Phil Ganong, always I appreciate you coming in. And Supervisor Gleason drove all the way down here from Ridgecrest to be on this program and do one segment with me. You're the only supervisor.
I heard Bill was on.
You're the only one that accepted my invitation from the board. I'm indebted to you, sir.
My
and
pleasure.
I thank you for your time.
My pleasure.
Okay.
All I want to say is, can Supervisor Gleason take the city council out to lunch? Chat with them a little bit.
If you buy him, I'll take him.
I'll buy, but it may be the Whopper.
Gentlemen, thanks. Gentlemen, thanks. We are going to pivot. Several new homeless projects on the table for the city of Bakersfield, one of them being pushed back. You're watching Kern County In Depth. We're back after the break.
Thanks, Jim.
This is the ultra-responsive Acura TLX, designed for where you drive.
Visit Family Motors Acura for attractive offers on the TLX.
Hey kids, register now for AYSO Region 73's soccer fall season. The season begins in August, but register now for soccer fun. Everybody plays. We have teams for different age groups and skill levels, and we are all inclusive with our VIP teams. We need adult volunteers. No experience necessary. Get in the game. Soccer is the most popular participation sport in the country. It's fun, fast, great exercise, and you'll make great friends. Register today for the Region 73 fall season. Go to the website on your screen.
With Team Tracy Tipton. Let my team help you find your happy place.
Not all barbecue is created equally. Our meat comes right from our counter. Our butchers are certified experts, guaranteeing your meal as fresh as possible. At Primetime Barbecue, we aim to please. We take your needs to heart, and your satisfaction is our guarantee. Come in today and try any of our signature favorites, like our Primetime Burger, our Kurobota Boneless Pork Loin, our certified Angus Ribeye Steak, and our house signature Tri-Tip Sandwich. Primetime Barbecue. Good food, good friends, good times.
This is the ultra-responsive Acura TLX, designed for where you drive.
Visit Family Motors Acura for attractive offers on the TLX.
Welcome back. Kern County's two most prominent advocates for the homeless in Kern County are with me now. Carlos Valdivinos is Executive Director for the Mission at Kern. Lewis Gill is Executive Director for the Bakersfield Homeless Center. Gentlemen, thanks for coming in. As always,
thanks for having us.
A couple of new developments to talk about today. Back in December of 2018, I think it was, we reported that the Mission had plans to use a piece of property on Baker Street for a new day center, a day shelter, and a resource center. It's my understanding that that property was donated to the Mission, right?
It was.
Okay. Now, it's close to the Mission, just a few blocks away. Moving the day shelter out of the Mission would clear up space for about 40 beds, right?
That's right.
And which you desperately need. And the plan was to make the day shelter a resource center as well, right?
That's correct.
Okay. Now I understand this is on the back burner. Has it been pushed back on the back burner?
You know what? It has for that property at the current moment. But we're looking at different options as far as bringing that day center inside of the facility, inside of the Mission property.
Okay. Why did you push it back on the burner? Why has this been sidetracked?
You know, we heard from the business owners in the community.
Yeah.
We had a hearing several weeks ago, and it didn't go so well.
Yeah.
There was pushback, like you mentioned.
They've endured a lot with respect to the homeless issue, and I understand that.
And I understand.
Yeah.
Listen, there's that area for years has been through a lot, and with a lot more homeless folks. I mean, that is the epicenter of homelessness, right in that area. I mean, there's a lot of it.
And also, there's a considerable amount of energy being put into renovating the area and revitalizing the area.
There is.
Economic standpoint. So, you're going to go rethink this?
Yeah, we're rethinking it. We're re-strategizing it, recalibrating, and we're looking at hopefully going inside Mission properties and doing something very similar. Yeah, maybe going up using the limited real estate that we have, and just being taking advantage of every single piece that we have.
All right, so now we have this proposal to build a new temporary shelter, I guess, closer to the downtown area at Wild Park. City officials have given their tentative approval to this. It'd be a 100 to 200 bed facility located in the northwest corner of Q and Golden State Highway. What do you think about that, gentlemen?
I think that we definitely need to expand emergency shelter capacity. Right now, our emergency shelters are running at about 96% capacity every night. So there's hardly any vacancy. We're going to have to do something to expand that availability because there are a lot of people outside.
So as I understand it, the idea is to assemble this and make it easily to disassemble after 5 years, or at such time where maybe the crisis, the homeless crisis, has receded to the point where maybe those beds aren't needed. I'd look forward to that day, but I don't know if it's coming soon.
You know, both Louis and I would agree on this one, that affordable housing is very much a need here in our community. I think even throughout the whole state of California. And
shelters alone won't get it done.
I don't think so. I mean, it's a start. I mean, we need to figure some things out eventually to get to a spot like Wheel Park or something else. I don't know, Jim. I mean, I can't tell the future. 5 years. I mean, if we don't build affordable housing at the rate that people are becoming homelessness, or they're going to get into homelessness, I don't know if 5 years will be enough.
No, you know, we're already getting pushback on this. Some people are saying, you turn a park into a homeless center, but right now it's essentially, that's what it is.
Well, we're in a situation...
Underutilized park.
In California, we're seeing this increase. Right, we know that 25% of the nation's homeless reside in California. Kern County is not immune from that problem. If we are going to address this growing need in our community, it's going to have to go somewhere. I hear plenty of frustration from the community. I understand that people would like things to be different. But if we want people to go somewhere, there has to be somewhere to go.
Let me ask you this question then. Who's going to run this? Who is going to assume the risk and the liability? I can't imagine that either one of you want to take on additional liability and additional risk for another shelter. But who do you think should run it?
Well, I can tell you that we've been traveling around the country. We've been to other states all over this
I'm going to ask
state.
you about that in the next segment, okay?
But so it's going to require somebody that knows how to run an emergency shelter. But I would tell you that everywhere that I've visited, the city and the county have been responsible for the facilities and what it's take to run the facility.
You know, when you look at putting the burden on a nonprofit to run something like this, I mean, it takes finances, it takes security, it takes all the components to get this running, and it takes a lot of money to run it. So when you look at that burden, you know, we're going to be hard pressed as an organization to jump in on that. So. That's something I think we just need to discuss with our county and city officials.
All right. And this is going to be a low barrier shelter. And low barrier shelters come with their own unique set of problems. And we're going to continue that part of the discussion in Kern County In Depth.
It's a look, a style, a way of life. Wherever you go, everything about it says luxury. And from the moment you sit behind the wheel, you'll just know and never look back. And right now at Mercedes-Benz of Bakersfield, lease a 2019 GLA 250 for only $349 per month, or get as low as 1.99% APR financing. So wherever the road of life may take you, make sure it's in a Mercedes-Benz. Test drive one today at Mercedes-Benz of Bakersfield and the Bakersfield Auto Mall.
It's our 4th of July event this weekend at More. Furniture for less. New bedrooms, new living rooms, new dining rooms in stock and on sale. Get our guaranteed lowest prices with no interest financing until January 2021. And pay no sales tax, plus free white glove delivery and installation. It's our incredible 4th of July event this weekend at More. Furniture for less. In store and online at morefurniture.com.
With the new dealership out there on 7th Standard, you know, we've been there going on 2.5 years. It's still a tight group. Everybody there is not afraid to do whatever it takes to make things happen. I think that's the core of Barry's RV is we work as a team, we get along, and we put the customer first. We're there because of the customer, not the other way around. I appreciate everybody putting forth the effort to be able to do that.
You're a person,
not a credit score. But sometimes your score gets in the way of the things you want to do. Personal consumer loans through NetCredit help you borrow up to $10,000. And you can check if you're eligible on netcredit.com without affecting your credit score. You may even be able to build your credit history as you repay. NetCredit, a more personal loan. Visit netcredit.com today.
Welcome back. Low barrier shelters come with their own unique set of problems, and we're going to pick up the discussion there. Louis Gill and Carlos Baldovinos are my guests. Correct me if I'm wrong, but people running low barrier shelters accept people into their facilities as they are, right?
That's correct.
Warts and all, if you will, right?
Absolutely.
No drug test. Even if you're under the influence of alcohol, there's alcohol in your breath, that's not going to keep you out of that shelter, right?
So there's
you could have pets.
Yeah, there's the 3 P's that they say you have to take care of. So partners, pets, and possessions. So those things can't keep you from being able to come in. Also, if somebody is active in their addiction, that shouldn't be something that would eliminate them from being able to seek emergency shelters.
This might be the first step to turning around that addiction and maybe finding recovery from that addiction, right?
Yeah, I mean, but if you add, you know, that component to tag along what Louis was saying, I mean, you got to have the mental health component has to be addressed at those facilities too.
Right.
I mean, you can't just house those folks that, let's say, they're, you know, intoxicated or high. And with
can't allow that to continue on.
And then you come in there and, you know, you got mental illness involved in there. I mean, that's a recipe for a disaster if not handled appropriately. So that, I mean, even with low barrier, I mean, the word is being used loosely.
Right.
But even with that, there are some sort of barriers. It's
and
not a
some sort of expectation.
Absolutely,
then if you're coming in, they're going to, okay, we understand where you're at now, but there is an expectation for you to take advantage of the services being offered.
There's an expectation that you're going to come in and participate with staff, and we're going to work with you, because the entire goal is to help somebody have a path into a home. We don't want people on the streets long term. The streets ultimately are fatal. And so our goal is to get somebody to be able to move home.
All right, well, let's go back to what you were talking about. You've been doing some firsthand research on this and how these low barrier shelters are operated. Who's running them?
So we've traveled to other states, particularly Texas, all over the state of California, and we've looked at a lot of different models. Everywhere we've gone, the city or the county has been entirely responsible for the facility, for the construction and the maintenance of the facility, and they have also made sure that the resources, the funding, was available to be able to help those folks, because what we're talking about is a highly concentrated group of very hard to serve individuals. And so you have to have skilled, capable individuals so that you can safely and effectively care for people and help them stabilize and then move home.
And just contrast that to the way you run the mission. I mean, you have a certain set of rules there you got to abide by, right?
Yeah, I mean, we have rules within our programs or the shelter. I mean, you can't have mass chaos. I mean, if you did, I mean, but
nobody's served well.
Somebody
by
could
that.
get hurt too.
Yeah.
I mean, the last thing you want is for somebody to get hurt with an act of violence. You know, and that's where, you know, we have to look at the whole scope and how we would run something like this. I mean, the security component would have to be looked at. I mean, I've had to, Jim, in the last year and a half, add security 7 days a week to the premises, just because the large influx of population that's coming in and getting services from all different parts of the community that I don't know who's coming in.
Well, is it possible to have a discussion about a county, the county and the city of Bakersfield and the homeless collaborative all working together to reach some kind of a operational agreement for a shelter like this?
Well, I think that we are in an unprecedented time of interest and engagement from both the city and the county. Everybody recognizes that homelessness is the primary issue of our community, and it must be addressed. And I can tell you, the city and the county at the highest levels are very engaged in this conversation right now. And I'm excited to have them at the table with us, and I think that we're going to be able to do some really good work.
You know, you say that this is the #1 issue in our community, and yet you hear, I mean, look at the day center. Here's an opportunity to do something good. I
would say that first and foremost, people are frustrated and we hear that. But if we want to affect this crisis, those services must take place someplace. There must be a location. And so folks are going to have to support it somewhere. We are getting regular demands, phone calls every day. Do something about this. And so when we put together plans like this, when we say we'd like to have a day center, we're going to add additional beds. We need the support of the community because we're trying to respond to the requests that are coming to us.
Yep.
And this
you got
puts
about 15 seconds left.
This puts a burden on our organizations as we're stepping up to the plate and doing this. And we just, my heart, and I know Lewis's too, I don't want to speak for him, but is for the community to come alongside of us and start tackling one life at a time, because we got to remember these are human beings.
That's correct.
This is somebody's child, somebody's mother, somebody's father. We can't forget that. And I really feel our community, as compassionate as it is, we can do it, we can make and really do significant changes if we come together and start tackling these issues.
And if the community has input, they should engage with their governmental leaders and
that is the number one things that folks can do to support this. Call your city council members, call the board of supervisors when these projects come up and say, we want to see them happen.
All right. Carlos Baldovinos, Lewis Gill, always good to see you guys.
Thank you.
Thank you, Jim.
I'm back with the final word after this.
The Friends and Family event is back, exclusively at Z's Please Sleep Centers through Sunday only. Save up to $800 on America's most preferred brands from Tempur-Pedic, iComfort, Sealy, and Beauty Rest. Like this plush queen set, now $399. And 60-month special financing. With our 100-night comfort trial and free same-day delivery, your satisfaction is guaranteed. So don't miss the Friends and Family savings through Sunday only at all Z's Please Sleep Centers. And online at zsplease.com.
A revolution is coming. A flaming hot burrito revolution. The Hot Tito's Burrito. Available at Tacos La Villa Mexican Grill.
Weatherby's exciting 4th of July sale is going on now. Take advantage of our special financing options or let us pay your sales tax. Plus, get free local delivery. Hurry in to find exciting savings of up to 50% off store-wide. Recliners starting from $389. Sofas as low as $489. Queen bedroom sets as low as $889. Dining rooms as low as $389. Take advantage of our special financing options or let us pay your sales tax. Plus, get free local delivery. Now at Weatherby's Furniture since 1921.
Car trouble? Tune in Monday during KGET's 5 p.m. news for Shop Talk with Richard Gauthier from G&G Auto Repair. Repair and maintenance tips from Kern County's most trusted auto repair shop. Brought to you by G&G Auto Repair.
Man, that's a cool looking hot tub. We should check on the baby.
He's so sweet.
Maybe too sweet? Internet's down.
Your home is only as smart as your internet. Get reliable AT&T fiber and get speeds up to 300 megabits per second and DirecTV. Bundle for $75 a month for 12 months. Limited availability may not be in your area. More for your thing. That's our thing. Call 1-877-ONLY-ATT.
We are nearly 7 months now into Gavin Newsom's first term as governor of California. What kind of report card would he receive from our 3 Republican lawmakers from Kern County? We'll find out next weekend. Assembly members Vince Fong, Rudy Salas, and State Senator Shannon Grove will be my guests as we focus on some of the hot button topics of this legislative session. That's all for now. For all of us here at 17 News, I'm Jim Scott. Thank you for watching and enjoy the rest of your weekend.